All right, welcome to Center for Wellness. I am Dr. Jorge Moreno, and here is Gabby, our administrative assistant. Welcome back. Today we are talking about Jin Shin Jyutsu. I learned Jin Shin Jyutsu in medical school about 30 years ago. I've been doing it for 30 years. I love it. It's amazing, so I'm happy to share it with you. And for the points that we'll go over in this conversation is cable jumping, AccuTouch, self-help, and the simplicity of Jin Shin Jyutsu. We'll start off.
Yeah, so I think just to start off, what is Jin Shin Jyutsu?
So Jin Shin Jyutsu is an ancient form of healing. It has its origins in Asia. So, Korea, China, Japan is where we say it originated from. It is based on energy flow, and if you look at Chinese medicine, which has a lot of history and a lot of science to it in the modern, medical community, there's a lot of studies showing that, acupuncture works. I was just looking at one for horses, acupuncture for horses. It's documented that it helps certain things. And so what Jin Shin is it's cable jumping, so it's improving flow in the body, energy flow. The Chinese have said that, where energy is flowing adequately, things are healthy. If there's a blockage in energy flow, physiology can suffer, or if there's blockage or too much or not enough energy flow, it can influence our health. So that's kind of the basic foundation of Jin Shin Jyutsu. It's a energy flow system, I guess is the best way to describe it. Yeah.
Okay. And is it, how would a patient do it? I know you said simplicity, but
yeah,
how?
It's really simple. So actually the way that I learned is my colleague in medical school, he said, "Hey, Jorge, I'm going to teach you something holding your fingers." I'm like, that sounds, simple. He goes, "Yeah, so you start off, usually we start off on the left side. So with the right hand, we hold the left ring finger. And so basically you just, you just hold it like that."
Okay.
And you could do this, you're a passenger in a car, you're watching a movie, you're having a conversation. Sometimes I'll do flows while I'm conversing with patients, Definitely I do it, as I'm getting up in the morning, as I'm going to bed. I'm always doing some Jin Shin for, again, 30 years. I love it. It works.
So how would this help a patient, or how does this help us in our healing process?
Yes, so great question. Again, if you look at energy flow, you're augmenting energy flow. So while I hold that ring finger, my right hand holding the left ring finger, I'm augmenting energy flow in the body. And again, going back to that first point up there, Jin Shin Jyutsu, it's like cable jumping. Most people have seen a battery that's not doing it. Mm-hmm. And then you get a good battery, you bring your car over, put the cables on the right post, right? And what do? You turn it over. So you're basically getting energy to flow through that battery that wasn't flowing really well. A great example, at the beginning of COVID, we had a patient who taking all the right supplements, vitamin C, zinc, I think he was 38 years old, and so he shouldn't be so sick. You wouldn't expect he doesn't have any predisposing risk factors. He eats super healthy, exercises, he's not super stressed out, and he wasn't getting better. And it was a week into it. He's still febrile, fatigued, and it's like, what's going on? Well, he had some blockages in energy, and one of the major things that we did for him to help him, and we talked to his family in a couple of days after his visit, but we established energy flow. Mm-hmm. So sometimes the body knows what to do, but it doesn't have the pathway or the energy to flow. Mm-hmm. And so when you hold the fingers, and again, this is probably the simplest one, I'll share with you now, is you start with the ring finger. After about 5 minutes, you move over to that finger, and you basically finish off with the pinky. And it lasts maybe 20 minutes. As you do it, you get a better sense of when you're done. And again, most people will feel like a sigh. One of our new patients in the last 3 months, She's in her 70s. She's doing it for her husband. And I said, what do you feel when you do it? And she says, my hands get super hot. What happens with your husband? He fell asleep. Okay, so to me, that I know she's doing it because the heat is her body's perception of energy flow, and his perception of energy flow is relaxation, right? So it's...
No, and that's interesting you say that, because as I'm holding it, I'm feeling I'm starting to feel, yeah. And so I think maybe, like you said, it varies. The results will vary depending on how we process things or energy. So, yeah, I actually do see it. I think another question for me would be, I know we've talked about this, Dr. Moreno, that as a mom, I like techniques or tools that are going to be easy, quick to learn, and effective. Yeah. So I think for me, it's important to find something that I can do either to myself or to my children or my family, my husband, that I can do, quickly, and then, help them in their healing process. So I know you said, the simplicity of it. So what, I mean, how long would it take to do, a sequence? Uh-huh.
Yeah, so probably the most common one that we give patients is the median sequence. And again, we'll have that available for you to download. And if you've never done it before, it could take half an hour. Okay. Some people, if they have good energy flow, when I do it and things are flowing well, it maybe takes 10 minutes to do, and that one's got like 7 steps. Okay. This one you could say it's 5 steps and maybe 5 minutes each one, so 25 minutes, 20 minutes. The other one that we commonly use is palming the calves. Right. And again, it could be done in 3 to 5 minutes. Some people, if there's something, going on that's critical, I'd give it 20 minutes, Again, we've seen that one, palming the calves, work phenomenal for people that are having fevers, balancing their body's energy, kind of drawing stuff out of the body. Like if the body needs to release inflammation, even emotions, if the body needs, our body needs to process stuff, the palming the calves works. We call it a detox tool, and it's super simple. If a patient's laying on their back and I go to the foot of the bed and I put my palms under their calves, so my fingertips are kind of behind the knee. It's a little hard for you to do it on your own. Like it's, I could do it on my own like this. Yeah, so you could do it that way too, but the correct energy flow would be to have your fingertips in the crevice behind your knee. So and again, it just depends on your flexibility and your mechanical position. This will work, but, and that's better with the fingertips behind the knees. And then the other piece is, when somebody does it to you, it's going to work better because now you have that added battery to help the energy flow, right? Yeah.
And so is this like for daily maintenance? Or is it just for like, you talked about COVID. Is it for when you're coming down with the flu or coming down with some type of illness? Or can they do it just for daily maintenance?
So again, this one is like a daily maintenance. And again, you could do it anywhere. You could be waiting in the line, and do it. I like the median sequence for daily maintenance. There's a couple of other ones that we could share that are actually daily maintenance. That's the title of them. Again, the patient that we were describing earlier, he had 2 years of a diagnosis. Basically, it's called membranous nephropathy. So he's peeing out protein, which we're not supposed to. Our kidneys are supposed to keep the protein in. And his blood test, 1 week after him taking supplements and doing this, his wife was doing the median sequence and palming his calves on him twice a day. His protein was normal after 2 years of being abnormal. So what did it? I think it was a combination of her, doing this, and again, she's doing it for a specific reason. But again, you could do it for self-help, like just, hey, let's just keep, the kids healthy, keep yourself healthy. And again, I think of, that concept of flow. When things are flowing well, it's, whatever comes, if a virus comes or some stress comes or whatever calamity comes, you're maintaining that flow, right? Good. So.
And it's simple and easy.
It's simple. All right. So did we hit all the points? Self-help, AccuTouch. I guess the only other things I'll say about AccuTouch, instead of acupuncture with needles, you're just touching the points. So, and again, they're really simple. And we'll have some diagrams available for you to follow. And again, thank you for listening to Center for Wellness on our social media and our website. And please, we ask you to try it. Let us know how you benefited from it. And if you have any questions, we'd love to hear from you. Thanks again for watching.
Thank you.